excited about our chat today. It's about a very serious topic that I'm really excited to learn more about. I have known about and been really interested in maternal mortality topic in general for a really long time now, actually since high school. And I'm very familiar with Every Mother Counts, which is an amazing organization that educates people about the issue of maternal mortality. But today we're going to be talking about the Black maternal health crisis in America. And I came across Dr. Heather's page recently and was just so interested in everything that she talked about when it came to this topic, and just being a doctor in general in this field and in this world is so fascinating. So I'm really excited for her to come on and to talk more about it and to educate us more about it. I'm excited to be educated myself more about this topic that I think is really shocking and surprising, especially in America, to have this be such a big crisis. So I'm really excited for her to join now. And you guys asked really amazing questions as well. So I have them on a piece of paper to make sure that I get to all the questions. Hi, how are you?
Hi, how are you?
Good, how are you?
I'm good. I actually was on labor and delivery like last night. So I was on a 24-hour call. So I got a nap in, and so I'm like ready to chat.
Oh my goodness. Well, thank you so much. I won't take up too much of your time, but thank you
No
so much for
worries.
taking the time to do this. It's such an important topic that I want to talk to you about, and I want to be further educated about, of course, but I think so many people wrote in not even knowing that this was such a big issue. So I know I reposted one of your slides, but before we get into it, I just wanted to go over a couple statistics that I think are really jaw-dropping, even for me as somebody who is aware of the issue of maternal mortality in America and in the world, of course, but knowing it has such a high rate in America and then also amongst Black women is shocking. So in your post, you had said that, had written that Black moms in America are 3 to 4 times more likely to die from pregnancy, childbirth, and post-childbirth than white moms. And in New York, which I found to be crazy, Black moms are 8 to 12 times more likely to die than white women. And I was reading a bunch of articles today and yesterday that you had been in and been interviewed in. And a lot of the statistics were also just really interesting to me. Of in America, the high maternal mortality rate is 17.4 moms die per 100,000 live births in 2018. And the CDC said that 60% of those deaths were preventable, which is insane. Yeah. Insane. So I think that, and just to go on to that statistic, that the World Health Organization said that Black moms' odds of surviving childbirth are equivalent to women living in Mexico or Uzbekistan, where there is extreme poverty. So I think that gives people just a little bit of a sense of how big of an issue this is, even in America, and why it's such an important one that we talk about and that you're talking about on your page, and that I'm really excited to be talking about here, just to be spreading awareness about this being such a big issue and to be further educated by you.
Yeah, so I mean, I think it was really shocking to me because as somebody who has also had an interest in maternal mortality rates and really kind of public health and public policy, because really the reason why the maternal mortality rate in general is something that we look at very closely for societies is that it's an indicator of health, the overall health of a society, because typically the people who get pregnant are young and healthy, right? And this is maybe their first foray into medical care since they were a child. And so if you have more people dying during childbirth, and usually it's because of other factors, which we will probably get into later. It can tell you about access to medical care that a community has or people in a country have. It tells you about just general health, like what types of diseases are prevalent. So it's really important. So that's why it's super shocking that the United States, which is on the front line of medical technology and lots of money and all of that stuff, our overall maternal mortality rate for any person is not where we want it to be,
Right.
but especially for populations of color, especially and Black women actually have the worst outcomes. It's shocking.
Mm-hmm.
And then for me, I was in the military for a long time. I was an OBGYN in the military, and I grew up in New York City, came back, and I had heard the statistic about the overall country in terms of Black maternal mortality, but I was shocked when I heard about what it's like in New York City, because we have a lot of hospitals here.
Yeah.
We have a lot of medical providers here, and the fact that there's such a stark difference, it's not just about hospitals, number of people who need to access a hospital, a number of moms that need to access medical care. It's something there's more going on there.
Yeah. Well, first of all, thank you for your service. That's so incredible that you were an OB/GYN in the military. And just amazing. But I think it's also, I mean, when you talk about New York being having such high numbers of deaths, it also makes me wonder, if we look at America as a whole, where in America do we have the highest rates of maternal mortality and also of a Black maternal health crisis?
Right. And so we do know that it's in a lot of the urban areas. We do know that there's a lot of issues in the South. Like, it's kind of scattered throughout.
Okay.
And what I thought was very interesting too was, when I was in the military, I actually was in a rural community. So I've kind of seen what urban medicine looks like and rural medicine looks like. And it's all like in the United States, and it's scary, because the issue is allocation of resources. It's whether medical providers have seen certain things and take certain things seriously. Like, if a patient is talking about, I'm in pain, or is the bleeding that bad? Or is there a high-risk medical provider, a high-risk OB doctor within a certain amount of mile range? There's lots of different things that collaborate, to cause this issue. But I feel like in the urban areas where we do actually we're not that resource poor, it enlightens you to other things like systemic racism and implicit bias. And then in rural areas, some of it is actually resource driven too.
Right. Yeah. And in one of the articles that I was reading that you had done recently, you were talking about people in certain communities, African-American women, not wanting to go and seek medical care because they couldn't find doctors that looked like them. And the reaction that you've gotten when people come in and feel like they can see themselves in you, and that they feel more comfortable asking questions about certain things, spending longer times with their care providers. Can you speak a little bit about that as well?
Yeah, sure. So given a lot of the historical issues with medical experimentation in communities of color, especially in the Black community, even within the realm of OBGYN, there is a huge distrust in my community, in the Black community, for medical providers. And one example of this is James Marion Sims, who is considered the father of modern gynecology. He did multiple experiments on Black slaves, some of which he owned, some of which he borrowed from other slave owners. And he had he set up a hospital experimentation area in his backyard, and used to do unanesthetized vaginal surgeries on women who were dealing with certain issues they had after birth. So there's something called rectovaginal fistulas and ureterovaginal fistulas. Basically, like, if because of a long childbirth, and we see this a lot in Africa now, in third world countries, because there's not as much access to C-sections and things like that, you can get these false connections that are made between the rectum, where your stool comes from, or your bladder, where your pee comes from, and it can actually just be leaking all the time, right? And so James Marion Sims experimented on Black slaves to perfect this procedure, did it completely unanesthetized, and some of these slaves got super sick, almost died, and all of that. And then he perfected the procedure and offered it to his white female customers, patients, with the option of anesthesia. And so stories like this go around, sterilization, that forced sterilization go around. And so there's lots of distrust. And so a lot of Black women don't feel heard.
Right.
And so when they see someone like me, they're like, oh my God, like sometimes they're like, I've never had a Black doctor before. And I think you'll be able to listen to me and understand what I'm trying to tell you. And to me, it's a beautiful thing, but also a sad thing, because it's like, I'm happy to be there, but I can't be there for everyone. And since there are only 2% of doctors in the US are Black female, it's like the odds are someone like me won't be there. And so for me, it's like not only increasing the amount of people, amount of diversity we have within the workforce, but creating a culturally competent workforce, because you know what, like we're not going to be able to change this overnight in terms of the amount of the equal representation of a diverse workforce, but we need to be able to have the people that are there understand and empathize with all types of patients.
I mean, I was also shocked when I read the statistic in one of your articles saying that in America, only 5% of practicing physicians are African American, and only 2% of those are women.
Yes.
So that to me is also insane. And I think that, when looking at this topic in general, and going back to people who have submitted questions to be talking about this topic today, the biggest topic was just why this is happening. Why is this such a big issue amongst Black women? Why is this such a issue that is overlooked, that this isn't an issue that we're all even aware of? And I know that in your post, just to quickly go over them, that you said that African American women have higher blood pressure, preeclampsia, gestational diabetes, preterm birth, postpartum hemorrhage, and peripartum cardiomyopathy.
You're doing great.
Thank you.
You're doing great with all of the words. Yeah, for me too, I'm like, lots of syllables.
Lots of words. But I think it's such a great, I would love for you to just give people an explanation as to why this is such a big issue in general. And why
it's multifold, right? So compared to some other Western countries, we don't do a lot of preventative care, right? Especially in communities of color, because to go to see a doctor for an annual physical requires that you have and it's not going to cost you like a ridiculous amount of money. First off, you have to have money, right? If you don't have insurance, so you need insurance or money, and you need good insurance, right? Because even if you have medical insurance, and I've been there, so I'm like, part of this is me speaking from my personal experience, where it's like, oh, like my first job after college, it was like, sweet, like I feel so great, I have health insurance, like. And this was back in the day before they kicked you off as soon as you were done with college. It wasn't like any of this, like, oh, you get to hang out till 26. Like I wished. Yeah. So I'm on my I'm making less than $30,000 a year in New York City, which was horrific. And I had this health insurance policy where like everything was $1 billion copay, in my opinion. $50 was a lot of money to me, right? And copays for medications, $20. Like that is a lot of money to me when I'm barely making rent and food and all of that stuff. So this is what a lot of people in these marginalized, underserved neighborhoods are going through, because okay, they may be working, but they're just making ends meet. And to then say, okay, you need to pay a $25 copay to go see your doctor to tell you, oh, I think you're fine. Like, people are like, I don't think I'm going to go, right? So what ends up happening is people feel fine, but they may have high blood pressure that they're living with, right? That was never diagnosed. Also, they may have other predisposed, if they're overweight, obesity, things like that. Those are my population's at increased risk for that. So if you're not going to seek medical care, or if you live in a neighborhood where it's really hard to find fresh produce, because I actually grew up in a neighborhood like that. I grew up in the Bronx, here in New York City. So it was like, fresh produce was expensive and it went bad fast. So it's like in these neighborhoods. And so it's like, am I going to buy an apple that is going to go bad by tomorrow, or am I going to buy a bag of chips that may last me a few days, like, you know,
Right.
like a day or two, right? Like, those are the decisions people are making. Qualities of food deserts. We know that there are a lot of food deserts in urban areas and in rural areas.
Right.
And so nutrition is poor, or poorer. Like baseline health monitoring is not really happening. And so by the time people enter these, you know, into their pregnancy, they're seeing a doctor after maybe not seeing one for 10 years. Then it's like, your blood pressure is bad. Like, you're, you know, 40 pounds overweight. You, did you know you had a cart murmur? Like, you know, there's like all these things that happen. And now we're dealing with it for the first time in pregnancy. And quite frankly, it's not long enough for us to fix these problems once you're pregnant, you know?
Yeah.
So some of those are baseline issues. Also environmental stuff. So in urban areas, for example, in New York City, the way how the highways were built, like the Cross Bronx Expressway goes right through major residential communities in the Bronx. And there are alarmingly high rates of asthma and any sort of environmentally caused health issues because they have, and it's like the only highway that allows big trailer trucks to go through in all of New York City. And so people, and links it to the rest of the state and also up into New England. And so those big tractor trailers are just, you know, pushing out all of that air pollution, and it goes into these communities. Like, I was actually driving to work the other day. I now live in Queens. And I was driving on the Bruckner Expressway, and they're doing massive amounts of construction and all these big trucks, and the exhaust is coming into my car, and I'm like, oh my God, this is awful. And then I look around and there's apartment buildings all over, and like, I know. What are people like breathing in? Like the dust, the everything. So all of those we know affect people's health. And so these are some of the things that contribute to those things. And then just stress. We know that living a stressful life also increases your risk of poor health outcomes. And like, if you are struggling to make ends meet, also, you know, there's like other factors in terms of, you know, concerns about like, you know, your safety, just baseline racism, things like that. We think that that also like affects people's health.
Yeah. One of the questions that people asked was if expansion of Medicaid or universal health care would resolve most of these disparities.
So I think probably a well done like single payer, basically universal healthcare system would probably help with some of it, because then it would increase hopefully the access to some of this care. But as I said before, it's like systemic issues. Oh, another thing too is like redlining, right? Like, which is like housing, like essentially like practices for housing discrimination, which create these pockets of communities of color, lower socioeconomic status, right? That plays into the tax money that goes into the hospitals and clinics, right? And so, yes, we can get a single payer system, but again, it's like you have to make sure that system is actually equal, you know, like that, like the hospital in Harlem, the hospital in the South Bronx, the hospital in Brooklyn, the hospital in downtown LA, whatever it is, right, is the same as the hospital on the Upper East Side or the Upper West Side, you know, or in Greenwich, you know, in Greenwich.
Yeah. I also was reading in one of these articles about women, because when we're talking about maternal mortality and the, you know, complications that happen with women when they're pregnant, during labor, and also postpartum. And there was a story in one of the articles of a woman who had a C-section, had complained about pain due to a C-section. There was another article that I read that actually talked about Serena Williams and her experience after her C-section, which I found to be really fascinating. And for those of you who might not know, she had a C-section and complained about feeling pain, was told that she was okay, and asked for a ultrasound on her lungs, right? And she had blood clots in her lungs. So
it could have killed her.
Yeah, that could have killed her. And so there is a lot of, and having just given birth 6 months ago, you don't know if, especially if you're doing it for the first time, is this normal? Is what I'm feeling not normal? And then on top of that, if you are a Black woman, that's also adding on to the increased risk of having complications after delivery, and also maybe not seeking out your healthcare provider, not going to the doctor, not being taken seriously.
Yes.
So can you talk a little bit about that? Because I think that's such a big part of this issue.
So something that's really interesting to note is there was a study that was done, I think within the last 10 years, if not just like slightly over 10 years, somewhere in that time frame, where they actually surveyed medical students and physicians about their perceptions of pain in Black women. And they found out that, and this is not, we're not talking about the 60s, we're not talking about the 1800s, we're talking about, there's a 20 in front of all of this.
Right.
That these medical students and physicians that were white or, you know, non-Black thought that Black women had a higher pain tolerance than white women, and that the thicker skin, actually. Some people literally said they think that Black women have thicker skin, so they have less pain than Black women. And this is something that, unfortunately, even I, as a medical student of color who was learning in the Bronx, had actually experienced a doctor who was teaching me tell me. So first year med school, in my clinical rotation, learning how to just interview patients in the ER. And ER, one of the senior ER docs was like proctoring us, right? And so she literally, I couldn't even believe it. You know, it's one of those surreal moments. Couldn't even believe it. So she's sitting there and we're like, okay, like, you know, like we're learning the things about, taking notes about physicals and histories, right? And she's like, okay, so let me tell you a little something about pain, right? And how patients perceive pain. And she goes into a detailed list of, by race, who you should, like, so she's like, okay, so like Asian women tend to be very stoic, so they don't show their pain. So they're probably in a lot of pain, they're not gonna tell you, right? Then she was like, white women, like, you know, they're pretty honest in terms of whether they're in pain or not, right? She was like, Hispanic women tend to be in way less pain than they exhibit, and so do Black women. And I was like, well, that's new for me. And the fact that you were teaching this as gospel truth is awful. And like your person, and I've heard it before. And so it's not like like there's subtle biases and things like that. And some of them are just very overt.
That to me, when I was reading that and also just hearing about people's experiences, you know, postpartum, it's just wild to me how, and I think especially for first time moms, it's, you don't know, you know, what you should be calling somebody about or what you should be going in and seeing a doctor about. And then if you add on top of it a lack of access to a care provider, or just lack access to healthcare in general in your area, that makes it, of course, even more dangerous.
And then also baseline health literacy, right? So we assume that people know the parts, like, so often, and that's something that I think also needs to be addressed, is like health literacy in general, and also basic anatomy, right? So often too, in like communities of color, there may not be, like, you may not have learned what all these parts do. Some people don't know that there are 3 holes down there, you know? And so something's happening to their body and they sometimes can't even explain it to you. So that's why oftentimes I tell my patients, like, just come in, let us figure it out for you and we'll explain what's going on, but just come in, because sometimes they're like, I didn't know that I needed to be alarmed because I didn't, like, I don't know what's going on. I don't even know what to call it. Or they may call into like our triage nurse system, where it's like, you know, for if you feel like something's going on, and they don't necessarily know, like, they may be describing something totally different. And so you're not really understanding maybe the gravity of the situation or what's going on. So there's communication deficits too. And if you don't know the culture of your community that you're working in, you may not understand that this person is trying to tell you that they have a wound infection in their C-section, like where their C-section is, or they have, you know, a vaginal infection or a larger thing. You may not know.
Yeah.
Because they don't know how to describe it to you.
Yeah. And I think that, you know, what I think a lot of doctors do well and some don't do well is also trusting your gut when you are, you know, feel like something might be off. And I think it's also a generational thing of, you know, suck it up versus calling your doctor and saying, this is exactly how I feel. You also had on your post written that Black women are less likely to get full prenatal care and they're more likely to have unintended pregnancy and also increased risk of C-sections, which I also thought was.
Oh, yes. So again, you know, it's access to care. It's like health literacy, things like that in terms of, so there is a higher risk of unintended pregnancy. So it's like, okay, like contraception goes to that, like access to contraception. If you don't have money to go to a doctor, will you be started on birth control pills? Like probably not, you know what I mean? If you don't have medical care, right, and you don't have a lot of money, you may not be able to even afford the box of condoms, which we give free condoms out in like 99.9% of all GYN clinics, right? FYI. So if you ever need like condoms, go to a GYN clinic. We got you covered. But you know what I mean? But that's the thing. If you're not there for an appointment because you're like, I don't know if I have to pay for this and I don't have the money for it, which there are lots of free places to get free access to GYN care. You're not accessing those. So you're going to have the oopsies. And then also too, it's like, you know, and then there's also access to like, you know, the choice to terminate a pregnancy, things like that. That is also lacking in these communities. So again, you have these unintended pregnancies, and then due to lack of access to care for different reasons, or even knowing the signs of early pregnancy, the highest rate of lacking prenatal care is in the first trimester for Black women, Black moms. So, and usually, and I see it all the time, it's usually they didn't know they were pregnant until about, you know, 16 weeks, 18 weeks, things like that, 20 weeks, you know, and so there's that end. And then also too, employment, right? If you're working in a place where they're like hardcore, you need to be at work at this time or you're going to lose your job. I have had so many patients who are like, yeah, you tell me I'm like, you know, I need to be seeing you every other week or something like that, or more than that because I have or childcare issues too, like where it's like, I don't have anybody to watch my kids. And if I leave my kids alone, then Child Protective Services is going to take them. So like, that's not going to happen. And in COVID, it's been really bad because like, COVID for prenatal care, like, you know, like we have televisits, right? Or video visits. You're assuming that people have a smartphone. You're assuming that they have access to Wi-Fi. You're assuming that they have access to a phone in general. I have homeless patients. I have, you know, you have all of these people and like they may still have kids that need to do like, you know, virtual learning, and they are told they have to sit in front of the computer with their child until 3 p.m. Our clinic closes at 4.
Just speaking to COVID being such a big issue for prenatal care, and you know, when you say that it's affected people's prenatal care, even when you say that people have to, you know, be mindful of who's going to take care of their kids, who's going to watch their kids, taking time off from work. And then on top of it, with COVID going on, you can't bring your kids to your appointment because you have to come in completely by yourself.
Right. You are literally that. I'm telling you, it's just so like, because that was one of the big things we like in like so many places that I've worked, and especially in places where people were really struggling with childcare and stuff. It's like, bring your kids in. I've done PAPs with literal babies screaming in my ears. I'm like, you do what you got to do. Kids like trying to like look to, and, you know, like
Yeah.
I've found kid-friendly ways to do lots of
Oh my-
GYN type of exams because
Yeah.
you have to, because
Yeah.
this is the world we live in, and we need to, like, because I never wanted it to be a limitation for my patients to seek care. And that's how many of us think, right?
Yeah.
But with COVID, it's just not, you know, safe to do that. And so it's like, it's challenging.
Yeah.
And especially in communities where what we do know is that there's a higher percentage of essential workers in communities of color. So, you know, and we're talking about your grocery store workers, here, sanitation, the transit, all of those things. There's a higher percentage of people of color who work those jobs. And so they're more likely to have the childcare issues and, you know, all of this stuff going on, in addition to a higher rate of baseline health issues in pregnancy. So it's just, it's not a great combination.
Yeah, no, it's definitely not a great combination. Whenever I would talk to people about that you and I were going to have this conversation, or when I posted about it, the biggest reaction that I get from people of all different backgrounds is, what can be done? What can people do who are not necessarily in the healthcare world, but you know, are like myself? I want to be able to help make this a bigger topic that we talk about, that people are aware of. And what can people who are listening to this conversation, or who might want to come back and listen to it and want to leave it feeling like they can make a difference or help out in some way?
Well, there's a few things actually, and like there's a lot more things than a few months ago. So I feel really happy about this, that I'm not like doom and gloom and then just like leave you guys hanging.
I know.
Like where it's like everything's really bad and I'm so sorry.
Yeah, and that's it.
Like, so there's actually some more things which I'm like super like excited about. So I'll talk about like the most exciting thing for me right now, which is the Black Maternal Health Momnibus, which is an act that has 12 bills that is going through Congress right now. And it basically addresses, and I'm actually very shocked at, like, because sometimes I don't think, I mean, I'm not like a political person like that, but I feel like sometimes like these things don't like actually address the issue. Sometimes I feel like sometimes it's like throw money at the problem, like run away really fast, like just throw it, like move. But this one I think is actually well done. It addresses so many different aspects of what's going on. So there's acts to talk to support, provide funding and support for community-based organizations that will help support Black moms and BIPOC moms too, because basically what it is that this is going to like address the places, the communities that are most impacted. And so it tends to be communities of color in general, but by far it's worse in the Black community, but it will help everyone. And so community-based organizations that will provide support and health literacy and those types of things for prenatal, postnatal, like, you know, just overall perinatal care. There's stuff that's going to be addressing climate change and environmental factors, like I was telling you about, that will affect the health of moms and moms to be. So there's that. There's a bill in there for incarcerated moms, because that system is like horrendous too. Like, I mean, really bad, I don't know if you guys heard, like there was a story recently of a lady who delivered unattended in her prison cell and had to chew the umbilical cord to disconnect her baby. Yeah, that happened like a week or two ago. So, terrible. I mean, there's lots of really, and it's bringing humanity back. There's bills to basically address any of the issues that are going on in the hospitals, to provide more funding and programs and things like that. And just making sure to extend insurance coverage, health insurance coverage for the first year, because currently that's not the case. It's usually the first 60 to 90 days and then you're dropped for postpartum care. And what people are starting to understand is that the postpartum period really is really forever, but especially the first year is very important. And that when we're looking at the statistics too about the highest risk for new moms dies within the first year.
Mm-hmm.
So, and it's usually, and a lot of that is pregnancy related. So it encompasses all of those things. In addition, so what I would say is, find out who your congressperson is and
Right.
hit them up and say, listen, I heard about this issue. And I heard about this bill. What are your thoughts on it? If you're not down for it, or like if you haven't heard about it, please get to know it and please support it, because it's something, and it's a bipartisan bill if everybody's like into that stuff, that people are like, this needs to happen. In addition, like educating yourself on some of the systemic issues that happen in medicine. So like, and in healthcare, because I think that a lot of times we focus on like kind of, some of the other social impacts that racism and prejudice and, kind of like socioeconomic status, how that relates to other parts of our lives, other parts of the world. But we never look at it we don't look at it enough in healthcare. And so there's some like really great books out there. I usually recommend either Medical Bondage or Medical Apartheid. That those are both really good books to read, that you can just get a history of like, why some communities of color are more hesitant to receive medical care, and just gives a lot of background into what's going on. And then, just, and also speaking up when you see it, like speak up on it. I think that's the biggest thing people can do, even if you're not in medicine. If you are in a clinic or you're in the hospital or something, and you see something you don't think is right, speak on it.
Yeah.
Because a lot of times these things are witnessed by somebody.
Right. Yeah. I mean, I think that's so important, and to give people the opportunity to, speak up on an issue if you see something that's going on. I also love the action part of it, which is to, call your congressperson, tell them about, it's called the Black Maternal Health Momnibus Act. And I'll put that in the comments below, because it is such an important act. I read about it yesterday, actually, and it has so many amazing part of it that would be incredible to have that.
It's very comprehensive.
Yes, no, it's very detailed, and I think it would do a lot of really amazing things to improve this issue. So I'm definitely encouraging people to call your congressperson, put that into effect, get that going, because
get it going, guys. Help us out, because because one of the big things, and it's funny because, I was just on labor and delivery like yesterday, like last night. And I work in the Bronx, right, in an underserved community. And, things happen, like you see, kind of like the scars of like medicine in underserved communities. And, just like having to talk up to like, make sure that my staff, like, my team doesn't feel defeated, you know what I mean? Where it's like, why can't we have certain, like, why don't our patients get certain things that other people, we know other patients do, that even we do, because we now may no longer live in that neighborhood, And sometimes you feel unheard. Sometimes you feel like, maybe this is just how, like, it feels insurmountable sometimes. Like I was mentioning it to somebody actually today. I was like, sometimes you like are working and you're just like, is this ever going to get better? And so it's really nice to see that other people are, looking at these things, are acknowledging that there's issues and things that need to change, and helping us do something about it. Because sometimes, when you're in the trenches, you're like, does anybody even know we're like just struggling here?
Right. Of course. No, I'm sure that's a feeling that you probably feel all the time, and it's exhausting. But I'm so grateful that we were able to do this conversation today, and that you took time. I mean, coming off of labor and delivery, you must be so exhausted.
It's a wild time.
But I'm really grateful that you took time to do this. This is such an important topic that I think that, the more we can talk about it, get people aware of it. You're doing such an incredible job. Thank you for your service that is continuing always. But I'm so grateful you took the time to do that. I'm gonna make sure we put all the information in the comment section of this post, because I really, I am serious about getting people to call and contact their congressperson.
Please,
I think that's how you have to make change. So
this is going to be amazing. Like, honestly, it's just so exciting for those of us who are in the birthing space. We were just like, this could really change lives, like a lot.
Amazing. Well, I'm so excited about that for you guys, and it's going to be amazing. And I'm excited to continue to follow you and to watch all the amazing things that you're doing and the way that you're changing the world and impacting people in your community, and also people who have access to following you on social media. So thank you for speaking so incredibly well about this topic and for educating all of us. And I'm grateful for your time.
Well, thank you for having me. I really appreciate you reaching out, because this is just something that, as I said before, sometimes we feel like nobody like really knew what was going on, or like, we're like, do people know? Do people care? I don't know. So it's really exciting that we're all chatting about it. And I hope that people learn something. And there are lots of great organizations. I think I mentioned some of them in a lot of the posts that I do. I know that you have too. So like that
every mother counts.
Every mom counts. All of those. For Cure for Moms. That's another really good one. But yeah, just like look, they tell stories of these moms that have struggled, who may have passed away in childbirth or in the postpartum period. And it's so important to read the stories, because there are people like our friends, our moms, our sisters, aunties, daughters.
Yeah, no, it's such a big issue. It's such a an insane issue that we have such a high rate of it in America. And it's an important one to talk about and to educate people about, women and also men, anybody who's interested in this topic. Or if you know somebody, the chances are that you know somebody who has given birth or is going to give birth at some point. So it is an issue that touches so many people. And also, we were all here because our moms gave
right, exactly. So, exactly.
We all know someone.
We all know someone.
We do. Well, thank you so much. I'll let you go and get some rest. But thank you again for your time.
No problem. Take care.
Bye.
Bye.